Good morning. Thank you very much for inviting me to present in the Traditional Health Practitioners Forum. I am Jennifer Orwa. I work at the Kenya Medical Research Institute. I carry out research at the Center for Traditional Medicine and Drugs Research. And I also have the responsibility to guide the resource development and knowledge management department in the Institute. So I will be able to talk about traditional medicine because I've had experience working with the traditional health practitioners as well as on the medicinal plants. So today we are going to discuss mainly the involvement of traditional health practitioners in healthcare in Kenya, the current involvement. We'll also touch on the relationship of the traditional health practitioners with the formal sector, the role we envisage these traditional health practitioners to help us in drug demand reduction, and what would be required to facilitate a successful collaboration between the THPs and the conventional practitioners to tackle the DDR challenges. So on the current involvement of THPs in healthcare in Kenya, we do know that traditional medicine in Kenya is widespread, particularly in the rural areas. And this popularity of herbal medicine has been attributed to the wider cultural belief. The community believes that people are much closer to nature if they use traditional medicine. They also are able to access the traditional health practitioners, and there is the belief that these traditional health practitioners are able to provide treatment at an affordable rate. In fact, currently there is a resurgence of interest in traditional medicine, and many researchers are actually now focusing on medicinal plants for their projects and to try and find out if there are potential medication for healthcare. This has actually been attributed to the fact that using modern medicine have had very many challenges in treatment of some chronic diseases as well as other conditions. Also, the inability of the modern health facilities in meeting the health demands of the population is increasing, and only few are able to access the conventional medicine. Currently in Kenya, the regulatory structure actually involves the regulation of the traditional health practitioners and the products. And the traditional health practitioners are actually registered by the Department of Culture. And the products are registered and regulated by the Pharmacy and Poisons Board, which is a regulatory authority of the Ministry of Health of Kenya. So we have two sets of regulation. And what is the current relationship of traditional health practitioners in the formal health sector? Our government do acknowledge the usefulness of traditional medicine, and there have been many initiatives to develop policies, strategies to guide the mainstreaming of traditional health practitioners in the healthcare. But traditional medicine has not been effectively mainstreamed in the overall Kenyan primary healthcare sector. And we still have a lack of legal and policy guidelines. But who is responsible for the derailment of implementation of these initiatives of developing policies so that we can mainstream the overall THPs in the overall traditional, in the overall primary healthcare? I would say probably all of us are to blame, all the collaborators may be to blame, even starting with the traditional health practitioners. The traditional health practitioners have been having a challenge of getting together, forming their traditional health practitioners associations so that they can understand each other and come together to focus on how best they can be mainstreamed in the traditional health practitioners. The conventional health practitioners also are taking long to accept the traditional health practitioners. So mainstreaming and getting them work together have been a challenge. The scientist is actually responsible also to help us with the, the documentation and finding safety and efficacy of these traditional health practitioners, because the conventional health practitioners would like to see evidence of these traditional medicines before they can accept to collaborate with them. So the scientist is also slow at doing this. And of course, if policymakers, they're the ones responsible for actually ensuring that this happens. So it looks like all the stakeholders in the traditional medicine space, we are all responsible for the slow intake and having this good relationship of THPs in the formal healthcare. And as I said, there has been push for integration of traditional medicine into healthcare since a very long time. In Kenya, we tried engaging the traditional birth attendants in the mainstream healthcare, but this apparently did not go well with some other practitioners, and it did not continue. So we have a challenge there. The THPs currently in Kenya, we have them being registered to practice, and also they own clinics, but these here, they work in silos. They are not in the hospitals or any recognizable healthcare sector. The government actually some time back established the Center for Traditional Medicine and Drug Research at the Kenya Medical Research Institute, where I work. And this center was established to validate practices and the products through evaluating the safety, the efficacy, in an effort to encourage streamlining of traditional medicine in primary healthcare in Kenya. This is continuing, and it's really my prayer that we will eventually be able to integrate traditional health practitioners with enough research evidence. So how do we envisage the role of THPs in drug demand reduction? I want to approach this by making reference to the 1990 World Health Assembly resolution on reduction of demand for illicit drugs. The WHO resolution resolved that preventing the spread of drug abuse in individuals, families, communities, and counties would take a big role in reducing drug demand. So where would the traditional health practitioners come in and help collaborate with this activity? As I had said, traditional medicine is culturally accepted, and so the traditional health practitioners are really well placed and have an advantage to be able to communicate at the community level where they work and be able to sensitize the community on drug demand reduction methods. They have the advantage for this. How about the resolution on developing effective approaches to treatment of drug dependence and associated diseases? THPs could come in to help with developing effective approaches, because we know that herbs exist for the management of several diseases, including even managing the reduction of drug demand. The only challenge probably here would be that it is important to establish scientific evidence, but it is well appreciated and acknowledged that we do have herbs to control this. Then the third WHA resolution was collaborating in controlling the supply of illicit psychoactive substances. So I envisage the traditional health practitioners being able to engage the communities in various fora. And because they are accepted, it is, I think, easy to have them talk to the community. The community will listen to them, so they just have to engage them in various fora in trying to tell them, the importance of controlling the illicit substances. So what would be required to facilitate a successful collaboration in tackling drug demand reduction? In my opinion, I believe that the good laws in Kenya, the policies, the robust regulations, and the preservation of intellectual property rights will help shape the traditional practice in Kenya. Acknowledging IPR would actually enable indigenous knowledge to share freely their knowledge. We know that previously indigenous knowledge practitioners have held their knowledge and handed it down from generation to generation and in secrecy. But if we allow them to actually protect this IPR, they will be able to share with us freely. And this, I think, would be able to facilitate collaboration. And implementation of guidelines for safety and efficacy evaluation in efforts to encourage streamlining of traditional medicine in primary healthcare in Kenya would be another point to be able to help us facilitate the successful collaboration. And of course, there is need to involve the traditional health practitioners associations, like in Kenya, where they are guided by the Department of Culture. This department has been able to form a National Traditional Health Practitioners Association. And this is able to make them come together and discuss in partnership. So I think these three would be able to facilitate collaboration. And I believe if we have all these in place, we can be able to successfully get the traditional health practitioners and their indigenous knowledge help us tackle the drug demand reduction. Thank you very much for listening.